I think that the most significant gap that I see in MS right now is our ability to detect that gradual progression that's happening. One of the terms that we use for better or worse is called smoldering inflammation. And we know that our physical examination and testing that we've used for decades, like the EDSS, are really insensitive to those changes that our patients are noticing. And many of us still feel that, including myself, that actually listening to the patient is still the most important tool because the patient will tell you what's happening. But I think that tools that we use in some of our present-day clinical trials, like timed 25-foot walk and symbol-digit modality test, can be, as well as 9-hole peg test, can be incredibly important to detect those mild changes over time. And those are things that can be implemented in the clinic fairly easily if people have the right tools and staff to be able to do it. So I think when we see people in the clinic, it's only a snapshot of their life in that 30-minute visit or maybe 60 minutes that they're spending in the clinic. And so these digital biomarkers, such as wearables, I think are really key to be able to understanding what's happening in the most important time of their life, which is all the time that they're not in the clinic and they're experiencing things in their everyday life, such as saying, I'm not able to walk as far, or I'm not able to walk as smoothly, or my sleep is impacted because I'm having spasms or something of that sort. And I think it's just exciting that our wearables today, most of my patients have an Apple Watch or some type of tracker, and they're really excited to be able to track some of that data. So I think wearables that are specific to issues that people have with MS are going to help us better address those symptoms and also better address the challenges and some of that progression that they're experiencing over time. I still think that we have a little bit of a gap and we have some time that we need to spend to be able to get there to connect this in the everyday clinic. But I think that by realizing that some of our patients may be bringing in this data, they may be using wearables themselves already, and being open to the fact that that is additional information that we can use to understand their quality of life. I think separate from that, with the updates to the 2024 McDonald criteria, we know now that there are some additional imaging markers that we can use to diagnose MS. And also I think that are predictive of disability. And so being able to work with our neuroradiology colleagues and potential advanced imaging techniques, there are some AI softwares that can be utilized with MRI. We may be better able to detect things like paramagnetic rim lesions or central vein signs, which can help us with diagnosis, but also with monitoring our patients over time.